Hi, good morning. Thank you for joining us on Community Coffee. I am your host, Trina Myers. And today's guest, we have Natalie Poli. I hope I said that correctly.
You did.
All right, perfect. So, Natalie is my neighbor over in Illinois, um, representing the Midwest for an upcoming, I believe it is state competition, correct? Or are you going to
Actually,
nationals?
Mrs. International.
Wow, how exciting. So, if you haven't caught on, I do have quite a few pageant girls that do come on the show and talk about their platforms and the things that they're doing in their community. And that's great because a lot of times women who are competing are very involved. They're doing community service, or they've started a nonprofit of their own, and they're just really making a difference in the community. And that really was the preface of Community Coffee, to help inspire people all across the world with positivity and enlightenment. So, thank you so much for joining us today, Natalie. Can you tell us a little bit about yourself and the title that you're going to be competing for?
Absolutely. Well, thank you for having me, Trina. And yes, the Mrs. International pageant is coming up. I'm actually leaving this within the next couple of days, actually. And you will see prelims and finals happening on Friday and Saturday, the last weekend of July, on the 22nd and the 23rd. Very excited. And I'm going to be alongside close to 60 other amazing women who, like you said, are doing tremendous amounts of community service. They have all sorts of organizations, a very diverse group of women, and I'm very excited to be alongside them. Myself personally, as you mentioned, I am your neighbor here in Illinois. I am about 35 minutes just west of Chicago, and I currently live in my hometown of Itasca, Illinois, alongside my husband, and together we have 5 children. I have 3 boys
Wow.
and he has a son and a daughter. So we have a really exciting and busy blended family. I took on a new role for this upcoming school year. So I am an official assistant principal. I'm so excited. So
Congratulations.
thank you. That was a lot of work in the making, and I'm super excited to welcome students and staff in the fall. A little bit about what I've been preparing for in regards to Mrs. International is with my platform and my brand, Stroke of Insights. So I am a 16-year stroke survivor, and I also have been the recipient of 2 atrial septum defect devices. And so I'm looking forward to bringing my brand, Stroke of Insight, to the national competition and being able to share all I've been doing with the judges and my amazing Queen sisters.
So, stroke of what was it again? Stroke
Stroke of Insights.
of insight. Okay.
Mhm.
So, one, you're too young to have had a stroke. I'm sure you hear that all the time. It's somebody who has a rare disease. I've
Mhm.
heard it many times growing up that you're too young to be sick. So I'm sure you hear that frequently. But can
Yeah.
you tell us a little bit more about your specific program?
Absolutely. So I like to say that I have 3 parts to the heart. First, it's community service, and I'm able to join forces with the Mended Hearts organization. It's a national organization, and I actually created and lead up their Chicago, Illinois Young Mended Hearts group. And what that means is we are putting together, myself alongside my 2 founders and the other members within our group, we're putting together the bravery bags for patients and families. And we just recently did a distribution at Rush Children's Hospital. And so we're filling these bags with necessities, support items. We have activity books in there for kids, but we also have some comfort items too. We've got some fantastic coffee we put in there for parents,
Oh,
some
nice.
comfort items and toiletries, just things to make the long hospital stays a little bit more comforting, but also some activities for the kids because they are spending a long time in their hospital bed. So it's really great to be able to reach a large portion of people through that community service event. And our Bravery Bag program is nationwide. So I'm just doing a little piece of the big puzzle here in the Chicagoland area. The second piece to the heart, as I call it, is my role with the PIC Society, and that stands for Pediatric Interventional Cardiovascular Society. And the cardiologist that pioneered and performed my procedure, the transcatheter closure procedure, he is now in Qatar, Dr. Hijazi, and he's the president of the PIC Society. He asked me to be the senior patient advocate. And what that means is I get the opportunity to speak with cardiologists worldwide. We've spoken to doctors in Argentina, Japan, China, and we're able to speak with them about what interventional cardiology things they need. It could be a procedure, it could be a device, it could be how we're working with the FDA here in the States and how they're working with a similar organization in their country. So it allows me to understand what exactly we need in the field of cardiology and how we're going to be able to get those types of things passed by our lawmakers. And that's where the third part of the heart comes in. Through the Mended Hearts organization, I'm one of 30 Action Network champions in the United States. And each year we have a Capitol Hill Day. This year, due to COVID, it was virtual, but I get to spend time advocating alongside our representatives and our senators and their healthcare legislators in talking about specific acts we might need passed in the Senate, things we're trying to get added to the Newborn Screening, Save Lives Care Reauthorization Act, lots of different ways that we can take what I'm hearing from the cardiologists through the PIC Society and then being on the front lines with Capitol Hill and actually trying to create real change.
It sounds like we have a lot of commonality. I do something
do.
very similar for the rare disease community.
Absolutely.
I guess that's why our kindredness, is just drawn, when you have something in common with somebody.
It really is. And you don't expect to be doing these types of things at this point in our life. And like you said, I do get it a lot that I was very young. I was just 29 when I had my stroke. I was 9 weeks postpartum with my second son, and I had a 2.5-year-old at home. And fine 1 minute, and the next minute, I just completely fell to the floor. And what we found was that I lived 29 years with undetected congenital heart disease. I had 2 holes in my heart and an atrial septum aneurysm. But the amazing thing, Trina, is that I came out of that situation unscathed. I had no residual brain damage. And that is something that you don't hear a lot of. You rarely are hearing people making a full recovery. And those of us that have, I just kind of looked to myself over the past 15, 16 years and thought, what's my why? I raised, my boys for a couple of years after that. I went back to school, obtained a master's degree, and kept thinking, what's my why? What's my why? And it wasn't until someone introduced me to the international pageant system that I realized I can actually make a difference and utilize the sport of pageantry as a megaphone to create advocacy. You put a sash and a crown on it, and all of a sudden, people listen. And I kind of feel we're going to do whatever it takes to advocate for getting echocardiograms in infants, because that is the one task, Trina, that will really show us if we have congenital heart disease and a defect within an infant. And that's how we're going to really begin to save lives, by not letting it go undetected, not waiting until someone has a stroke or a major cardiac event. So much work packed into what I've been doing, yet we have more work to do.
Oh, absolutely. Now, I know you typically hear about the symptoms of how to identify a stroke in adults.
Mm-hmm.
So are there symptoms that physicians or maybe even a parent would recognize in their child and their infant to say, hey, something's not right? Because you and I both know we've had to become advocates for ourselves.
Mm-hmm.
And, I've then learned how to help educate others to become an advocate for themselves. But these babies they don't have a voice yet. You know, I mean, they cry, but you just don't know exactly what's wrong. So, are there those signs that can help?
Well, I think the key is, like you said, it's obviously being an advocate for yourself. But as I had talked with you a little bit before, the whole point of my podcast, Stroke of Insight, is to actually hear more stories like mine, like yours, so we can begin educating the community because there's just too many people to reach. We can't do it just by talking to people that we come in contact with. So the first thing we find is the struggle with new parents because they aren't familiar with different signs that you might see in an infant that could cause alarm. An example is I had an individual on my podcast where the hole in the heart, we're all born with a small hole in our heart. That's how we get oxygen when we're in the womb. Well, within a week or two, it's supposed to naturally close. In 1 in 20, it doesn't. Well, as her son's hole started to close, that actually was his way of receiving oxygen. And what that did is that put him in cardiac arrest. And
Oh,
she
wow.
noticed when he was just laying down sleeping, and she had had a few children before him, she did not like the way she saw his chest going up and down while he was breathing. And she took him to the pediatrician, and they immediately sent her to the hospital because he was in cardiac arrest. But for our new parents, right, or even parents that have multiple children, you are seeing babies, right? They're breathing, you're watching them breathe. You're seeing
Mhm.
all sorts of different things. They're crying at different hours. You're trying to get to know your child at that point.
Right.
So, this is why I'm really trying to advocate for echocardiograms in infants. And this is one of my goals because that is a test that is invasive, it's effective, and the cardiologists at the Pig Society worldwide are saying that is what is going to allow us to detect congenital heart defects because we are doing so many procedures on infants. The
Mhm.
procedure I actually had, Trina, is performed on infants. I was a patient at UIC in Chicago in the children's hospital. I then followed my cardiologist to Rush Children's Hospital. These are the types of doctors that are pioneering this. They're trying to support these babies. And it's us as adults that are now realizing that we've had undetected congenital heart disease all of these years. And now we're looking to some of these physicians who are pioneering themselves within interventional cardiology to save
Mhm.
our life too.
So um the the projection is that every child would have this particular screening.
Sure. Ideally, that is what we would love to see. Right now, part of the newborn screening is doing a pulse ox.
Right.
So they're putting that on their finger, they're checking their oxygen level. And that is right now one of the indicators that's being utilized to screen our newborns, to take them through a series of tests, and then it's based upon those tests right now that you might look a little bit further. And an echocardiogram is an x-ray of the heart. It's an
Mhm.
ultrasound. And so it's very invasive. But unfortunately, we have a lot of work to do. We have to get the insurance companies to be able to approve this. There's
Right.
costs associated with that. We also need to ensure we have enough resources, but that creates jobs. We're going to need more ultrasound techs. So little by little, we're adding things to our Newborn Screening Saves Lives Reauthorization Act of 2021, but it's still not enough. And I say, I gave birth to two beautiful, healthy boys, and no one noticed my oxygen level to be in the mid 70s. It should have been in the 90s. And I had a nurse tell me, well, Natalie, I will have some new nurses that I might be training come out. She worked in labor and delivery and say, there's something wrong with that pulse ox machine. It's reading this number, and we know that's not right. And she says, I tell them, it's not the machine, it's the mother. So now we need to look a little further, but unfortunately, it was missed with me. And I started showing signs when I was actually in your area at the University of Iowa. on the University of Iowa dance team. I had some signs that something was going on then.
Huh. And so it was the birth of your second child that just really kind of put it over the edge.
It was. They feel that since I had the 2 holes and the atrial septum aneurysm, the blood was already moving improperly through the heart. And when you're postpartum, you have a higher blood volume in your system. So they're thinking that environment within my heart was just perfect for a blood clot to form. And that blood clot went from my heart to the left side of my brain that controls your speech and language and all the feeling in the right side of your body. But I had no evidence of it. So I had physicians, neurologists saying, you could have had a complicated migraine. Maybe you should join a trial. The FDA said I wasn't a candidate for the procedure I needed because they wanted me to have 2 strokes or a stroke in reaction to the Coumadin that I was on. And anyone that knows me very well knows that I don't take no well as an answer. And when you're a young mom, I said, absolutely not. I'm not joining a trial. Regardless of if you think this is a complicated migraine situation or not, I have 2 holes in my heart and an atrial septum aneurysm, and they need to be closed. And so I just really pushed forward to find a physician that would do the procedure. But I had the atrial septum defect devices put into my heart, not the PFO devices, because I wasn't a candidate. But they're the same devices. They're made of mesh. They're about the size of a nickel. They're just a little bit larger than the PFO devices. But it just really trained me, Trina, to realize how much we have to advocate and how we have got to continue to advocate with lawmakers and their healthcare staffers by real people like me sharing my story, teaming up with the Mended Hearts organization and the Adult Congenital Heart Association to be a participant in those days. Because when they see someone, right, like you and I, we look very healthy. No one believes it. No, they don't believe it. But
they don't see us on the couch on the weekend.
Right?
Exactly. No makeup
and I keep saying, if stroke or heart disease is coming for you, it's coming for you. It doesn't care your size, your weight, your gender, your race, your age. It does not matter. There's a stigma, I think, around stroke and congenital heart disease that we're still trying to break. And it's going to be something we're going to be trying to break for a long time. But I was a very active young woman. I danced at the University of Iowa. I danced for the Chicago Bulls. I was a Chicago Lovable. And when I'm gasping coming off the court, asking my girlfriend for her inhaler, she's like, you didn't even have asthma, Natalie. I said, I don't care. Please give me your inhaler. I couldn't breathe. Going to the physician and saying, something's got to be wrong. My chest hurts. It feels like there's an elephant sitting on it. Well, you might be borderline asthmatic, but that's about it. No one is checking. So what do we need to do earlier on in children's lives to ensure we're not hearing about that athlete hitting the floor? I mean, I'm just so grateful that I'm living to tell it.
Do you think also on the flip side of that, so you have the children's, screening, but as well, I've worked in the healthcare field for many years on the marketing side, but, working alongside physicians, I've heard the mortality rate of mothers is significant, way more than what it should be in America, right?
Yeah.
So, do you think that could also be a screening for mothers when they find out that they're pregnant? Because you can definitely handle a pregnancy a lot different if you are aware of this situation.
Absolutely. And I love that you brought this up because this so greatly connects to a story that NBC5 here in Chicago did with myself, the American Heart Association, and Rush Medical Center here in Chicago. And they reached out to me because the American Heart Association was doing a study with strokes in women under the age of 35. And so I was able to partner with them and share my story because that did happen to me. And one of the
Right.
things we were talking about, the neurologist from Rush brought up, was we need to find out why this is happening to women. Is it due to birth control? Is it due to pregnancy?
Mm,
Is it due to hormones? There's so much work to be done, Trina, in this area, but this is a trend. We're seeing this. And I do have that story, that feature on my Instagram at Mrs. Midwest International. Anyone can check that out. I also have some information in my bio, but that is actually the news story that brought myself and my co-founders to the Young Mended Hearts organization together. They saw that news feature here in Chicago, and they wound up emailing me through my website, nataliepoli.com. And they said, I had the same procedure you did. I had a grand mal seizure and a stroke. And we
wow.
immediately bonded because of that news story. And you bring up a great point. We have got to just continue to do more research and find out why this is happening to young mothers. In my case, we talked a little bit about the fact that I had just began, you know, I had a 2.5-year old, I had a 9-week old. You're just beginning your recovery really post
Right.
6 weeks. But I just had a great environment in my heart for that blood volume, that increased blood volume. And then it was moving already in the wrong channels. And that clot just happened to find its way to my brain. But luckily, it either broke up or it shot off and got reabsorbed into my system because there was no evidence of it. But
Wow.
I'm here to tell the story, Trina, and I am here to ensure that what happened to me does not happen to other people. If I can help it, as long as I'm here advocating, that's
Yes.
what I'm going to do. I feel like that's a story that happened to me, and I'm blessed that I have my speech. I have the feeling back in the right side of my body. I'll dance it up in the kitchen and let my kids laugh at me all day long. My husband will be like, just let her go.
Right. Right.
But,
Hey,
you have to live life now.
exactly. You are
Yeah,
living proof,
yeah.
that you just never know. And so you have to live every moment to the
Mhm.
fullest. Natalie, is there any type of events or ways that people can help you? One obviously is helping you with advocacy and reaching out to their local legislators. But besides that, is there anything else that they can help you?
Well, here's what I ask of everyone, because kind of like what we say sometimes with raising children, it takes a village, especially
Yeah.
when you have multiple in different areas in different sports. But I just encourage everyone, if you're not sure how to help or how to advocate, or you know someone that maybe this story sounds a little familiar, feel free to reach out to me. I have a website, nataliepoli.com, and you can fill out the contact us form, and that would be a great way to reach out to me. And then we'll talk and we'll see, is it something you want to be part of my Young Mended Hearts group because you are a congenital heart disease patient and survivor, or is your child, or is your mother or father? It doesn't matter that you're not in Chicago. You can be part of my Young Mended Hearts group anywhere. We do exclusively bring those bravery bags here into Rush Children's, but there's lots of other ways to get involved. And if you wanted to be an Action Network champion, you fill that paperwork out, you talk to the Mended Hearts organization, and you see if there's an availability for you to become one of 30 something here in the United States, because we need more advocates. You can reach me on social media, Mrs. Midwest International, and send me a message. But there's lots of ways for you to get involved. It's just finding what might fit best for you. It's taken me almost 2 years to get to where I am today, Trina. And that 3 parts of the heart that I talked about earlier has really been forming since 2 years ago. Since I started with the international system, I was always advocating in different ways, but never in such an organized fashion. So now being able to partner with physicians and hear exactly what we need from interventional cardiology, but then
Mhm.
also being able to bring that information to lawmakers as an Action Network champion, and also being able to serve the community by bringing our children's patients and their parents those bravery bags. It's just an amazing, I like to say, made of mesh, just like the devices in my heart. It's just amazing to be able to bring those three things together. And I'm more than happy to help guide someone down a similar path or one that might work for them, because we need more advocates.
Absolutely. Well, I think it's great what you're doing because, as somebody with a rare immune deficiency,
Yeah.
I've lost a dear friend of mine to heart failure because of her misdiagnosis and late diagnosis in life. It ended up affecting her heart, and she passed away a few months ago. And then I have another friend who also was later diagnosed in life. And
Mhm.
because of that, it affected her heart. So,
Sure.
it doesn't have to be just somebody saying that they have a heart defect. It
Right.
could be a comorbidity with another disease or some symptom.
Absolutely. Well, and I also encourage anyone listening to follow the international pageants. As I mentioned, July 22nd and 23rd, we have the preliminary competition and the finals. There will be a link on social media, or you can check out the Mrs. International Pageants website and watch me advocate live on stage.
Yes.
And my husband will be part of that event with me. And we're really just excited to kind of see this come to fruition now. It's been something I've been working on for a long time. And no matter what happens, I consider myself a winner in every way, shape, or form, because without being Mrs. Midwest, I never would have been doing what I'm doing. And this is what I needed in my life to find my why. And when this is over, no matter who wins, I'm still going to be continuing on all the work that I'm doing as an Action Network champion with the Mended Hearts Association, as a senior patient advocate for the PIC Society. And we even have our PIC Symposium coming up actually here in Chicago in September. So there'll be a lot of physicians there really looking at what we're doing from an interventional cardiology perspective. So I've been able to educate myself, Trina, in many ways that I never thought I would ever
Right.
do. You
I
know,
understand.
this all of a sudden you become a cardiologist, by trade, you become an
Right.
advocate by trade. You also have your day job. And it's funny when people say, well, how do you do it all? I can't imagine doing it any other way. I was already
Right.
advocating before I became Mrs. Midwest. And it's something that I'll always do after this, because we need to tell our stories in order to create
Yes.
awareness, advocacy, and to educate. So I appreciate you and everything you're doing with your show and your podcast and talking to people like me.
Oh, my pleasure. Well, is there any last thing that you would like to share with our viewers?
Actually, just to continue to follow your path in any way that you see fit. Maybe you're dealing with some other type of disease, or you've had some other type of medical experience. Never let anyone tell you no. Never let anyone tell you it's not possible. And I always live by my motto: be brave, be you, and be bold.
Oh, beautiful. Well, thank you so much for joining with us, Natalie. And thank you all to our viewers for tuning in today. I hope that you have a wonderful rest of your day and the rest of the week. And we will be watching diligently, Natalie, for you to bring home that international crown.
Thank you. Really appreciate your time today, Trina.
My pleasure. Well, you all have a wonderful day, and I will see you all soon.